The Director General, Nigeria Center for Disease Control, Dr. Chikwe Ihekweazu, has stressed that coronavirus is spreading fast and causing mild symptoms in some and severe illness and death in others in the country. Ihekweazu said many people had continued to experience fatigue and other symptoms even after recovery. He urged healthcare workers to maintain a higher index of suspicion for COVID-19.
We were reminded of the stark reality that we live in now. We are now living with a virus that has now affected 100,000 lives in Nigeria and well over 1,300 deaths in 11 months. And probably there are many more. That's what we've been able to confirm. The virus that causes this disease, COVID-19, is spreading very fast, causing mild symptoms in some and severe symptoms and death in others. And many people continue to experience fatigue and some symptoms even after recovery. So this disease in many people doesn't end after 2 weeks. We're rolling out the use of RDTs in 5 tertiary hospitals in Abuja from Monday next week. This will increase access to testing. We then intend to roll out across the rest of the country from February. This will make testing a lot more available to hospitals, both for healthcare workers themselves and patients coming to these hospitals. You will also remember that we used RDTs in NYSC camps across the country. We found that in every state in Nigeria, we tested people coming from different states, and we found positives among individuals that had reported to NYSC from every state in Nigeria, every single state in Nigeria. So there's no state that is spared of this virus. We would have been surprised if there were, but our data suggests that we are right in saying that there's COVID circulating in every single state in Nigeria, and we all have to continue the hard work that we're doing. So again, we're asking people to take some responsibility around the activities we're engaging in. When we say people should take responsibilities, when you organize a large gathering where people are invited, some people are invited and have a choice. Many others do not have choices. The people that work in these places don't have a choice on whether to come or not. They have to work. And therefore, if you're managing a facility where people are invited for a wedding and the place is full and heaving with people, at least there'll be many staff that are serving there that don't have a choice. So by doing that, you're exposing them almost deliberately to this virus and potentially to death. We must begin to protect our most vulnerable as we get deeper into this phase of the outbreak. While we may all be tired, remember this virus is not tired and is taking advantage of our tiredness and our fatigue. So again, I advise Nigerians to stay at home as much as possible, avoid large gatherings, especially indoors, with poor cross-ventilation. 100,000 cases are not just numbers. There are fathers, mothers, brothers, sisters, children, whose deaths we will all mourn, and the pain of their loss felt deeply.